Well, welcome again, everyone. My name is Jessica Desardin. I am a program coordinator in the Office of Community Engagement. We are glad to have you join us today. I'd like to begin with a statement from the Office of Community Engagement. We wish to acknowledge the Indigenous people who are past and present stewards of the land on which we pursue our just cause of a healthy community for everyone. Please note this session is being recorded and please be sure you are muted throughout the presentation. We encourage everyone to use the chat bar to share comments or post questions for our guests at any time. This monthly series features community partners and the important work they are doing. We highlight their goals, motivations, and accomplishments, and the ways they have partnered with people and programs at MCW. At this time, I would like to introduce our Senior Associate Dean for Community Engagement, Dr. Stacy Young, who will say a few words about our featured guest. Dr. Young.
Thank you, Jessica. Today I have the honor to introduce Natalie Bomstad as our featured guest for this month's Spotlight. Ms. Bomstad is the Executive Director at Wello, which is a local nonprofit in Green Bay that works to advance equitable system change efforts to ensure all people and places can thrive. Natalie has over a decade of experience leading multi-sector collaborations and coalitions to drive community-rooted, equitable, collaborative well-being efforts. She is passionate about co-creating transformative policy, system, and structural change to improve individual and community well-being through strong relationships and trust. Thank you, Natalie, for being our featured guest today. I would also like to welcome today's facilitator, Dr. Leslie Ruffalo. Dr. Ruffalo is an associate professor and the co-director of medical student education in the Department of Family and Community Medicine here at MCW. As a community-engaged health researcher and educator, she has worked extensively with neighborhoods and communities across the state of Wisconsin to address health priority needs generated by community members. Thank you so much, Dr. Ruffalo, for being our facilitator today, and I now turn the session over to you.
Fantastic. Thank you, Dr. Young, and thank you all for joining. Any day of the week that somebody tells me I get to spend my lunch hour with Natalie is a good day. So I'm really excited for this session to be a part of it and to have a conversation with all of you and with Natalie about the excellent work that's happening at Wello. So Natalie, I'm not going to waste any warm-up time. We're going to get right into it. And it's pretty typical of these sessions. We always like to kind of start off learning about our featured guest. So please tell us a little bit about yourself.
Beautiful. Well, first, I just want to really thank everyone for the opportunity to be with you all here today. It is such an honor, and it has been such a privilege to be able to work so closely with the Medical College of Wisconsin and the incredible work you're doing to create healthy and well communities across Wisconsin. So thank you for allowing me to have some time here today to talk a little bit about our work. So we started with a song. I think as I was thinking about a song to start today, I really wanted to lean into one of the things that I really believe deeply in, which is the power of community. And when I hear that song, I always get re-inspired that there is a future that we can co-create together. And so I hope today that we can kind of lean into that power of community and what is possible and really feel empowered ourselves to really think about the things that we can do in our unique spheres and really utilize our power and influence to create some real positive change. So who am I? I like to start with kind of three pieces. I'm a Youper. So for those of you who are, I know we might all be currently in the Midwest, but for those of you who might be new to the Midwest, a Youper is a person from the Upper Peninsula of Michigan. So I was born and raised actually in the Upper Peninsula of Michigan, actually born in Green Bay and raised at the Upper Peninsula of Michigan. And so a lot of my upbringing was really deeply connected to nature, deeply connected to my local community, which was quite small. From a very young age, it was really instilled in me to be a part of our community, the importance of giving back, even when you had a little, how important that was because we all are interconnected. From an educational standpoint, I went to the Michigan Tech University or Michigan Technological University, and received a bachelor's in science degree. My first path was I really thought I was going to go into a pre-professional pathway. I wanted to be a dentist. And so I really took that route. After graduating, I actually worked in a dental office. Really got that chairside experience. And I also did some work in Central America around kind of oral health, specifically in underserved communities, those communities that, often lacked access to oral health for their kids, for their whole community. And it was through some of those experiences that I started to kind of get this little itch on the side of, and kind of more exposure to this thing called public health. And as I started to kind of learn more about public health, I began to be very drawn to it, and ended up kind of shifting gears and really pivoting professionally, and went to receive a master's in public health at the University of Minnesota, and specifically around public health administration and policy. So one of the things that's always driven me is really thinking about how systems and community can really come together, and the ways in which that we can really grow and create thriving communities when we do things differently, when we really center those at the margins and really think about kind of the whole. And so that's a little bit about me kind of from growing up education-wise, and then that brought me back to Green Bay, where I have been at Wello for the past 10 years. So a couple pictures here you see kind of along that journey has always been a lot to do with kind of giving back and community service. And so you see there's a picture of some work that we did in Puerto Rico. The center picture is in Panama. Graduation, so a celebratory opportunity. And then the three on the side is my little family. We have a tree farm. My parents have a tree farm up in the Upper Peninsula, and some Upper Michigan vistas for you all there.
Wonderful. Thanks for sharing all that, Natalie. It's so nice to know those little pieces of your journey that have brought you to where you are today. So let's move right into that. We'd love to learn more about Wello. Dr. Young did a great job of sharing the snapshot of who and what Wello is. But if you could, share with the audience how you got involved in the work that you do today. What is your favorite part of the work you do at Wello, and who and what is Wello?
Right, absolutely. Sometimes, what we encourage you to do at Wello, and maybe even after today is, some people use Wello as a greeting. So Wello, hello. It's really meant to be an opportunity for us to come together. And our mission is really all about that. Our mission is to co-create community conditions that are fair and just to drive high levels of health and well-being for all. And you see our guiding principles here on the screen as well. So 6 key guiding principles undergird our work: equitable prosperity, being community-driven, really leading with hope and inspiration, committing to the long term. We're going to be talking about well-being and systems change, and how do you engage community in work that can be somewhat wonky, meaningful measurement, as well as shared risk work and celebration, which we find is really critical to the work and kind of really maximizing and continuing that momentum. So what is Wello? What do you do? Well-being can seem very expansive. And so sometimes when we talk about Wello and we talk about well-being, people kind of look at you with this perplexed look on their face, like, oh, gosh, well-being, it's like asking me to boil the ocean with you, right? And it seems really hard and it seems really big. And at Wello, we really break things down into their incremental parts, right? And so one of our key pieces is to really start small, which I'll talk about in just a moment. And so it's like, it would be hard to say, come boil the ocean with me. But at Wello, we're like, but what about this water in this cup, right? Let's think about how we can work differently together. Let's think about what it might take. What are the inputs? What kind of strategies might we want to test and measure and see the impact? And while we're doing that intentional work together, we're also building the trust and foundational relationships that will help us kind of do the next big thing and the next big thing. So we recognize that well-being can feel very large, and we really try to, work together to kind of make it seem very achievable. So one of the things, and I know I see Gail on the call here from our team as well. This has been something, and I want to give attribution to Gail on this aha moment for us. When we think of Wello and kind of this work, we really work at the intersection, right, of systems and the people that they're really meant to serve. So when you think of kind of our logo, those kind of two semicircles there, we really think about it as community as that really big piece, right? And then you have systems, and systems are always interacting in different ways with community. And at the center is really where Wello likes to work, right? Are there systems that are working? Are there systems that aren't working? If they're not working, why not? How do we really work in that messy middle area to ensure that the systems that are meant to serve folks are actually serving the folks, right? And I also just want to recognize that the community is the bigger portion of this. We really lean into being community-centered and led in the way in which we think of that work. And we really believe that the transformative change that can happen to really create those community conditions, right? The things around healing and collective joy, that all of that is fostered when we work in a different way. So in terms of community engagement and our approach, there's kind of 4 key things that we really talk about when we think about community engagement. And that is really 1, working up from need that's identified by community, right? And so we have a number of different strategies and mechanisms by which we can do that. And it's really important that those things really effervesce or bubble up from the community itself. Something really important, and I know Dr. Ruffalo and the folks at MCW and others that we've worked with, that's really important is not to skip steps and to show our work. So, when we're engaged on an initiative or a project, say we've identified a need from community and we're getting some partners together, we're all bringing different mental models to the table, right? We're all bringing different biases to the table. We're bringing different experiences, which is what makes it rich, right? It is what makes it really strong. It also means that we can often skip steps in that process, right? We can skip the step of maybe not everyone is grounded with the same understanding. Maybe there's different levels of understanding of the community need. There's different understanding of maybe the system, right? And so it's really important, we believe in our approach, is to really continuing to go back in our minds of, are we skipping a step here, right? Do we need to go back? Do we need to show our work? Do we need to really understand what's happening from multiple perspectives and really bring that forward? Third is really around starting small. As I mentioned with the boiling the ocean versus boiling the water in the cup example, we really believe in the power of starting small, and because we believe that it allows you to iterate, right? It allows you to innovate. Big ideas, we always say, let's have big ideas, let's have big visions. And to execute those, we need to kind of get to a proof of concept. We need to start to test those things. Sometimes if we go too big, we also skip steps, right? And it gets farther away from being community-centered. So we really believe in that incremental, start small, making that room to innovate and iterate approach. And then we're always taking action with a generational focus. We really want to, so that includes both past, present, and future. So in any one issue, we want to ensure that we develop that understanding, that grounding, and are really looking at creating generational impact. And so finally, the last thing I would say about specifically about Wello is, those are kind of some framework type in kind of like how we see the world. And so you're like, okay, that sounds good. What do you do? Right? So we also have a number of specific initiatives that we can go into, and I encourage you to kind of connect with us on, everything from really looking at building local resilient food systems to creating active connected communities, really focusing on ways in which we can continue to advance inclusion and belonging in our community, mental health, work in schools with Farm to School. We have a community well-being framework and approach that includes a survey and a panel and some ground truthing. There are a number of different things that happen to make this vision a reality. But instead of kind of diving into each of those individually, I just wanted to share this image. And I share that I am a biology major by background, so I have still that little bio part of me that always wants to kind of dig into the science here. And I was fortunate enough to do some work with the Robert Wood Johnson Foundation over the past year. And as we were kind of digging into kind of like, what does it mean to do community engaged well-being work, I kept coming back to this image in my mind, which was around mycelium. Right. So for those other bio folks on the call, this is an image that a wonderful artist was able to create for us. And it's really around, showcasing the interconnectedness that we all have, not only with one another, but also with our place. And so as we think about our work at Wello, I often think about mycelium, right? I think about the ways in which we are all interconnected. Mycelium in kind of in the environment are really these channels and these networks that help support one another. So in a forest, there are mycelium networks, right? And if one of the trees is cut down in the forest, they send these signals, hey, something's happening, right? There are opportunities to really ensure that all of us can thrive. And so I really wanted to just leave you with this image rather than going into each of the initiatives, which we can do and, might come out throughout the conversation, to really just think about, what does it mean? What would it mean in your community? What would it mean in your neighborhood to be connected, and what are those mycelium connections that we all have, and how do we continue to foster those through community engagement, specifically with people and with our environment and our place.
Awesome. Thanks. One of the reasons I'm so glad that Wello and Natalie are being spotlighted today is I always have the privilege of leaving my conversations with the Wello team with these little one-liners or these ideas that I've benefited from. So I'm so grateful that we get to bring that to our audience today. So for all of you that are listening along, I some of the concepts that are really resonating with me are the ideas of, let's not try to boil the ocean, let's boil the water in the cup. I know Natalie mentioned that a few times. Another statement that Natalie made that I just think is just so positive is this idea of how do we effervesce the community and really build up ideas on community needs and community opportunities. So I really love that emphasis on effervescent. I think it's the right word to think about. The other thing I'll say is I love this idea of don't skip steps. And for those of you that come from a long-standing background in community engagement, the idea of sometimes you go slow before you go fast, I think that is so spot on. And I think the last thing I'll kind of mention before we shift to another question is that I just have I again feel the good fortune of having witnessed Wello really honor that premise of don't skip steps. So I've seen the intentionality around that when we're working together during the last 4 to 5 years of our teammates calling us out to say, wait, what are we missing here? Are we skipping a step? And so much intentionality around kind of pumping the brakes a little bit and just really examining the work and the efforts to make sure that we are not skipping steps and having those routine check-ins. So thanks for the behind the scenes authenticity that your team brings to that piece of the work. So you've guided us through some of the shared principles at Wello and those 4 steps of doing your work. Can you share a little bit with our group who are perhaps maybe new to community engagement, new to initiating partnership work, collaborative work? How can people effectively engage with the community and build relationships and partnerships?
Yeah. Thank you. Yeah, excellent question. I think one of the first things that really came to mind with this question is really to develop a deep understanding of what you mean by community engagement. And what I mean by that is, do you want to engage the community for a specific time period? Are you looking to develop a long-standing relationship? Do you mean engagement in, there is a project? Do you want information from the community? So really understanding, I think, at the front end, what community engagement means for you is really important. Because one of the things that I have learned and have heard very clearly is, folks can try to engage with community in many different ways. And you all probably have a number of different strategies and different things in which we can look to utilize. But at the end of the day, to me, community engagement, to do it effectively, it is about building trust, and it is about coming into that space authentically. And it means to be very open, and it's going to take time, right? And community will ask you what your intentions are, right? So you better be pretty clear about what those things are, right? And, when we engage, so from an organization to organization way at Wello in community engagement, we often kind of frame this as like, what's the win-win? Right. So really kind of understanding like what would a win look like for you for us to work together. Right. And this is what a win would look like for us, like, and really setting kind of like really out on the table what the expectations are. Right. Being very open. And I think kind of trying to really go into that conversation, understanding your own biases, right? Understanding that what you might think, it actually might really shift once you're starting to engage in those conversations. So really kind of, I think, leading with that openness, recognizing that, especially for an initial engagement, like knowing why. Why do you want to engage in the community, right? Because community is going to ask you those questions, right? And there's not necessarily right or wrong answers here per se, but really to understand that to build that foundation of trust, it will take time. You need to show up in community, and just be really open and willing to have to not have what we often, one of our team members, Beth, give a shout out to Beth. She always says like, don't pick the winner out the gate, right? And I think that that's such a great thing to think about when you think about community engagement. Oftentimes, just based on our work and the way in which systems are structured, we're asked to, what are all the things you're going to do in the next 12 months? What are all the things you're going to do in the next 24 months to address this issue? And how are you going to engage community in that? Engaging community in that type of way, I've often seen not work well, right? So how are you building in pathways that allow for community to really come together and to really co-create that process collaboratively, but also to push back on the fact that we might not know what the end result looks like. And actually, that's a sign of success in community engagement, because it means that we didn't pick the winner, right? We didn't go in with a preconceived notion of exactly what community wanted, especially if you're not part of that community, right? Because we know that that can cause a tremendous amount of harm. And so just really being, I think, open and willing to really explore what that looks like is really important.
So I'm going to give a little spin-off question to that, but could you share with the group, you're covering kind of some ground on how you build trust with the community and really initiate those partnerships. I've heard you mention a couple times this idea of co-creation. It's in your mission statement. Could you share with our group today, what does that look like? What does that co-creation piece look like for Wello? I know that you've kind of hinted around it a little bit, but yeah, let's dig into that concept a little bit more.
Yeah, absolutely. So I think, for us, whenever so in the health and well-being arena, we'll call it, in that sector, there are, I think generally some things that we know support health, right? Access to healthy food, right? Moving more, stress reduction. There are these broad buckets. For us, we say, okay, so there's these broad buckets, but what's happening that not every community, right, is experiencing high levels of health and well-being? And so we start to dive deeper, and co-creation really is about recognizing that, we might not have the answers, right? But collaboratively we might. But we can have a lot of, we can kind of not only waste time and resources, but we can actually erode trust that has been established in the community if we're doing that in isolation. And so co-creation is a part of everything we do. So when we talk about Wello's community health and well-being measurement work, we have a community measurement team that meets quarterly. We go through, like, here's what we've asked prior. Here's what we know is kind of bubbling up from the community. Do we add more questions to this survey? How would you ask that question? And we have a very diverse community measurement team to really bring forward voices from many different aspects. Well, that's really not how we would say it in our culture. This is how we would say that instead, right? And so and then really thinking about, okay, how can we really co-create that so it gets the closest that we can get, right? Nothing is ever perfect. So I think from a co-creation standpoint from Wello as well, as we always think of our work as dynamic, it's iterative. And so try to like throw perfection out of the window here. We want to make sure co-creation is really about ensuring that at every step of the way, the groups and the communities that we're working with have active voice in how those things happen. It takes time. It can go slower, right? Then I think, Dr. Ruffalo, you mentioned, sometimes that means going slow before you can go fast. And it can change, rapidly sometimes based on other things that are happening in the community. So whether we're talking about community measurement, or we're thinking about, gosh, how do we address food insecurity in our community in ways that actually support local farmers? Well, if we want to do that, we need to know what's happening with local farmers, right? And so we need to have them part of the conversation. And we need to meet farmers in the ways in which like they're ready to meet, right? And so finding those connections. So at Wello, we have to be very kind of almost very fluid in the ways in which we work to ensure that it is co-created.
Right. I love this idea of the community measurement team brought together with diverse representation, from Wello and from other community partners. And you've also talked about measurement and outcomes and how the need for, I think evaluation and metrics to be the starting point, not the end point, to be dynamic and iterative and moving the discussion along. So I think we all can acknowledge that we're kind of in a culture and an environment right now where it is very outcome driven. It is very, what is the bottom line? What impact did you make? Can we measure impact? So could you share a little bit about kind of Wello's perspective on balancing those two forces of, yes, we, a lot of times for accountability to our funders, to other stakeholders, we do need to be outcomes driven, but also how we really want to honor our roots in using data and using measurement and metrics to drive those novel iterations.
Mm-hmm. Yeah, it's an excellent question. And it is, it's an interesting balance that we often have to strike. I think one of the things, even before thinking about like those outcome pieces, is we are also really intentional about partnerships. And so thinking about, in a specific, so say in like a funder relationship or funder partner standpoint, really ensuring that group knows what we do and how we do it and what the expectations are. So again, it goes back to that win-win. So whether that's like really identifying the win-win in a community partnership standpoint, and also those strategic partnerships that might be some of your funders, right? So one of the things that we talk about to kind of balance those two things is, we talk about our approach, which is around, right, system strategy around how we improve well-being. And in some of those instances, there are going to be very strong and easy to measure quantitative pieces. How many students received farm to school lessons, right? How many pounds of produce were expanded access to? How many farmers? So there are some quantitative metrics, but we also I feel like part of the work is really to amplify the importance of qualitative and the importance of stories and subjective measures that sometimes just don't get the glory I think that they deserve, quite frankly. So when we do our community health and well-being survey, that entire survey is composed of subjective well-being measures, meaning those questions ask people how they feel about their lives, right? And we know from science, right? And we know from research that how people feel about their lives impacts how they behave, which impacts outcomes. So even in the way just to describe that for folks, that we can kind of, it's to kind of draw the line, right? For folks who may not, have that deep understanding. So whether that's a funder or that's really sharing back some of the outcomes of the work, that's where storytelling is really important, and where developing strategic partners are really important. So I feel like at Wello, it's like, yes, our mission is around well-being, and then we start to take on these other pieces too. We're like, well, and we also want to showcase the importance of lived and learned experience and community voice and qualitative metrics, right? And so we're not so reliant on quantitative, and also recognize the importance of quantitative measures, right? Because those are the measures that many of our systems speak in, right? And so we want to make sure that we can continue to speak in that same language and offer additional ways of understanding. And I think the last thing I would say is, such a great example of this is when we only are thinking about maybe a quantitative type indicator, whether that be something like, at a like a broad scale, like GDP, right? And that's the measure of success, right? But then it's not matching up with what we're seeing in terms of health indicators or quality of life indicators or health, like longevity. So it's like, there's got to be something else that we need to address here. Or if you look at just a measure of health and you look at like a measure of body mass index, well, what else is happening there, right? So if we're not asking about, gosh, how are you feeling in terms of your mental health? Have you experienced depression and stress and anxiety? What's happening in terms of your ability to have affordable housing, safe transportation, access to healthy foods? So if we're not broadening that conversation to include those social determinants of health and those other things that we know are really influencing those overall outcomes, we're not showing the whole picture, and we're also not able to act in ways that can truly transform those systems to better serve the people in our communities.
100%. Thanks so much, Natalie, for breaking that down for us. I think that tricky balance, if you will. Yeah, wonderful insight on that. I'm going to slightly shift gears a little bit. And I think just given how, again, I've come to observe how close Wello is to so many, just an incredible network of community partners in Brown County and surrounding counties. Can you share with our audience if Wello, if you and your team are noticing any themes of needs or wants that are effervescing from the community?
Yes, I think in a high level, I think what we continue to hear from the community is so many of our current systems just aren't designed for those at the margins, right? And so we continue to see these gaps in access that lead to increased kind of disparities in health outcomes. And so I think it's really important, really seeing how that is bubbling up from the community. And so whatever aspect you're talking about, it's just like almost this palpable frustration, right? That these systems are just not designed for those at the margins. And how do we start to shift that? So one of the analogies I like to use is kind of something in public health called curb cuts. So back in the 70s, there was a group of folks who came back from war and had some physical disabilities. And they were very frustrated that they could no longer access their community in ways that they could before when they were able-bodied. So, doing things like going to the grocery store, picking their kids up from school, going down and enjoying a pint in the local pub, right? Their community was now cut off from them. And so they began advocating for curb cuts. So if you're familiar with a curb cut, so if you're on a sidewalk, it's kind of that little ramp type piece that cuts into the road. And they were able to, they had this groundswell of advocacy, and they were able to get a city in California to implement these across their community, their design. And what they found was that not only did it help folks who may have mobility impairments get around their community, but it also helped, the folks who were pushing strollers around, people who were visiting their community who had luggage, people, dropping off packages at businesses and unloading, right? And so it had these broad impacts. It was designed for a specific community that was at a margin, right? But it had these cascading impacts. And so oftentimes at Wello, we're thinking about, well, gosh, what's the curb cut here, right? What is that thing that maybe if we tested that, does that actually open up opportunity, not only from those that we know are at the margins currently, but has these broad sweeping impacts? And so I feel like, it's like, that's what we're hearing. This is an approach that could help address that. And it's something that, we kind of try to keep in mind when we think about how we would move forward in a community and centered way.
Great. Thank you. I have some questions that I'm going to sit tight with here for a moment. I want to invite our attendees, if there's questions that are on your mind that you want to make sure we have time to address with Natalie, please feel free to plunk them in the chat. We did have one actually come up here, Natalie. So the question is referencing one of your last comments about looking at the person and community holistically. Can you speak about your holistic perspective and how it supports cross-collaborative relationships?
Mm-hmm. That's an excellent question. Excellent question. I'm going to use food as an example here because it's such a great example. And I hope that through this story, it'll kind of answer some of kind of what is at the crux of this question. So back when Wello began, in the beginning, when Wello began in 2010, one of the first things that we started was really leaning into food systems as a key driver of health and a key driver of well-being. And through some of those initial initiatives, we were able to establish SNAP infrastructure at farmers market. So folks who had food benefits could use that. They could get double dollars to kind of double their impact there, and thereby helping support local farmers. We also established our Brown County Farm to School Task Force. So working with all of our school districts in our area to really think about how we can advance getting more local food on the lunch tray and kind of all the systems surrounding that. So that work had kind of, it started and it kind of kept going along. In 2020, when the pandemic hit, one of the things that we heard from those partners that we had been engaged with, but kind of, almost honestly, fairly narrowly, right, in some of those specific areas. One of our partners, Casa Alba Melanie, actually, called us and they said, this is, our community is really in dire need for some supports. In particular, access to food has become very challenging because food benefits were expanded at a state level. However, many of the folks within our community have what's called ITIN numbers. So they live, work, pay taxes in the United States, but they're not eligible for some of those federal benefits. We also know that these folks in our community are some of the most hard hit by the pandemic. What do we do? At the same time, we had farmers who we had been connected with through some of the farm to school and farmers market work say, well, gosh, we had helped create some institutional wholesale markets through some of this work, but now restaurants are closed. They don't need our food, right? We have all this food now, though. And our farmers markets were like, how are we going to open? How do we have the PPP? So we were able to very quickly turn around a grant proposal that allowed us to purchase the food from the local farmers and distribute it to the folks in need while supporting the local farmers market to remain open. And we actually gave double bucks to those folks so that we could continue to circulate that. But it brought forth a bigger issue. If we are to look at this holistically and think of all the cross-sector partners involved, we needed to look at it as a food system. And we needed to look at it as how are we creating a local resilient food system that's really co-created from not only the farmer perspective, but also the supply chain perspective, the institutional market perspective, and that end user perspective. How does everyone have access to that? Are those things connected right now, or are they not? One of the first things was a recognition that our farmers market EBT and double dollars program, you could only get double dollars if you had SNAP. That wasn't a requirement. That's just how it was set up to begin with. We're like, oh my goodness, this doesn't have to be this way. And so we started a different way of getting those double dollars to communities who most needed them. They were still at the farmers market, so folks on SNAP could still get those. But we created some different opportunities and pathways that were very specific and embedded within some of our culturally specific resource centers to begin with, and then expanded out to some of the other resource centers in the area. So as we did that, it started to become very clear that if we were going to have a conversation around co-creating a local resilient food system, we needed to really expand those cross-sector partners and start to have opportunities for that farmer to really intersect and understand what's happening at a community level for the person, right? And have this bi-directional feedback loops that were created, thinking about who has access to farming became a very clear gap in our community. We were able to work with Dr. Ruffalo and her team at MCW to really work intentionally with a group of Hmong farmers to think about how can we provide additional training, capacity building, and access so that that group of farmers as well could start to build their small businesses and be able to be a bigger part of the local food system. So that is an example of how, you know, some of these things can start, but we're really taking that broader holistic view. And from an individual standpoint, we have heard loud and clear that folks who now have access to this healthy, locally grown food, it is about the food, but oftentimes it's not about the food at all, right? It is an entry point into having a broader conversation of what's going on. We probably all can think about how food is very cultural or probably associated with some tradition in our own lives. And the same is true in our community, right? And so we actually, through some of the projects that we have completed and are currently completing with MCW, have really started to understand the importance of how food can be a unifier around well-being, how it can start conversations around the challenges in mental health, especially when culturally it's very taboo not to talk about it, right? It's really important to understand that there are trusted places in the community that when asked a question on a survey versus when asked a question in that space by someone that they trust, they answer that question differently. How does that help inform how we work in community? And so hopefully it's just kind of a small example of how it builds this mycelium connection, right? It builds the network, and it's constantly growing. And I think that's some of the beauty of it. It's not a finite thing. There's always room to grow.
Great example, Natalie. You nailed it. And just thinking about your quote, it's about the food, but it's not about the food. And you can swap in the example that you just gave, any other social issue. And I think that same quote would apply. It's not about it is about transportation, but it's not about transportation. It is about health access, but it's not about health access. To really get into those cross collaborative relationships that are really going to be impactful at getting at those system changes, those policy changes, those environmental changes. So that was a perfect example. We are going to keep you on your toes, and we have another question coming in from the chat. So Cheryl is saying, love this work. How might faith communities and their contribution to flourishing best partner with other public partnerships?
Yeah, that's an excellent question. I think the faith community is such an important part of what it means to thrive and what it means to flourish in a community. So I also feel like faith communities are places where people who go there, that's a trusted place, right? And so I would encourage you to let's connect and let's let's get further involved in that space. I think just thinking about the way in with the way in which faith communities play such a bedrock role in many people's lives, I think there's tremendous opportunity to really connect some of these things that we're talking about in those ways. And I know many of the faith communities, especially in our region, are doing that, and they're doing that very well. So I think it's really about kind of reaching out and again finding that right partnership and that right thing to start with. But I think they have an integral part to play.
Great. Thanks for that response, Natalie. So another question coming in here. So we have a participant that really appreciated how you highlighted the example of building a solution to meet people at the margins, the example, the curb cuts, that benefits the greater community at large. So the follow-up question is, how do you engage leaders that might be resistant to that approach, especially in our current polarized climate? It's tough. These are
Excellent
great questions,
question,
everybody.
and that's a whole webinar.
Yes, it really is.
It really is. It is an excellent question, and I think it's certainly on our minds, as I know probably many of your minds as well right now. I think the thing that I keep coming back to is really staying true. You know, I showed those 6 guiding principles, right? And I showed our mission statement. You know, those aren't things that we shift. Because, you know, the direction of the wind might shift, right? And so like really being strong on these are the things that we value, and this is what we believe, and this is what we are really, this is our purpose at this organization, and kind of leaning into that strongly, I think is important. And I also think, you know, one of the things that we know has really resonated kind of across different ideologies, across different communities, is really focusing on impact, right? And focusing on some of those stories, right? And showcasing, you know, oftentimes what tends to happen is we maybe agree on that there's a problem. How we what the solutions to those problems are often where it gets really in the gray. And so really focusing on kind of that impact and elevating that. I will also say it doesn't always work. Right? I mean, it really doesn't always work. I think one of the things that we feel fortunate about in Brown County is, you know, we often say, like, we are working towards well-being, and if you want to work towards that vision too, you know, there's a place for you here. And that means that we're going to operate with these guiding principles, right? And we're going to operate with this foundational level of understanding of trust, and that you know, everyone needs to be seen as the beautiful, wonderful human that they are. So I think to some extent in this space, it's, you know, staying true to those things, and to recognize that that isn't always the popular thing, right? And it won't be. And there will be times when folks, you know, we've seen, you know, that you might lose funding because of that. You might lose key stakeholders because of that. Some partners might go silent because of that. But I would say, you know, one of the things that I always think about is, why am I here and why am I doing this work? And if this thing that I'm encountering right now, you know, takes me off course to that, then maybe it's time for me not to be here anymore too, right? And so like also recognizing that you're a person in this process as well. And sometimes it can be a lot. So making sure that you're taking care of yourself, you're checking in with yourself, recognizing that there's going to be a lot of challenges and bumps along the way oftentimes, and just being very clear about what's core for you. What are your non-negotiables, and staying true to that.
Outstanding. I love that emphasis on just self-care and doing those check-ins with yourself, to ensure that you're in the right place at the right time to do the work you're committed to, personally and professionally. I think that's outstanding. While we're kind of winding down here on time, I still invite folks to put a question in the chat if you still have any. I think we have time for maybe 1 or 2 more questions. Natalie, I think you provided such a fantastic introduction to us all today on who Wello is, what Wello does. Just so many great thoughts for us all to leave today with. Is there anything else that is on your mind or just, yeah, what else would you like people to know about your organization?
Yeah, absolutely. I think one of the things that we are often challenged with in this work is that by very nature of how philanthropy is set up and, how individuals, humanistically, we want to see things in very discrete ways. And I would just encourage you all, I think Wello is a representation of something that can, done with intention and certainly strategically and with community, we can kind of shift that paradigm a little bit, right? We can think differently about how we coexist together, people and with our planet. And so I would just, I feel like sometimes people want to put us in a box. And we're probably also, we're those folks who are like, let's think expansively here. We don't want to be in this box. So I would just encourage you, there are all different types of philanthropy and all of them are filling very real needs in our community. And hopefully today you've learned about a different type of philanthropy, a different way of being, a way that, can really lean into that system strategy and do some different things and doing very intentionally. Obviously, our hope is that by really having things community-centered, co-created, and really focused on ways in which we can connect systems and community together in new and innovative ways that we can create really thriving and flourishing communities. So appreciate the opportunity to be with you all here today.
Oh man, our cup all got filled by spending time with you, Natalie. Thank you so much. So inspirational, so positive. Lots of great kudos coming through for you in the chat. We'll make sure to save the chat and share it with you. I'll just call one comment out. So Sarah saying, you have articulated community engagement so well. Thank you. I think that really sums it up nicely. Again, just so much gratitude for the work that you and Wello are doing, and I'm glad that I get to keep working with you all long term. So Jessica, I'm going to turn it back over to you to kind of do our wrap up announcements and what's coming next for our Spotlight series.
Yes, thank you. And thank you, Natalie, for sharing with us today and allowing us to learn more about you and Wello. And thank you, Dr. Ruffalo, for facilitating today's conversation. Of course, thank you, everyone, for joining us today. We are privileged to have you join us every month. We are having a bit of a tech difficulties here with our screen, but we invite you to continue to connect with Wello. I have shared their website on our chat. You will also be receiving an email later tomorrow with links on how to continue to connect with Wello and Natalie. We invite you to fill out our survey. It only helps us get better. And then we invite you to join us again next month, May 28th. We are featuring here is that QR code if you want to support Wello. Yes, we're featuring Feeding America, Eastern Wisconsin next month, May 28th. You can expect to receive the registration link in the next few days. Again, thank you everyone for joining us today. Enjoy the rest of your day.